Around patient self-care, I have an asthma patient who waits until she's real bad before calling me. She's always hoping if she'll get better on her own. Too late, she ends up in the hospital. There's so many patients who go back to full activity before they should. Then they end up in the emergency room, have to be readmitted and even reoperated at times. How do you get patients to take better care of themselves? Well, to be honest with you, I spent my career giving advice to people, but never exactly telling them how to do it. Call me if you have a problem. Doesn't really help people. So we need to start to give people much more information about what to look for, who to call, what to do in the meantime. And there are a lot of people who've risen to the challenge. I just collected some interesting examples of what's out there for people around dialysis. There are videos. There's even a graphic novel. There are booklets that can be given out. And there are also very successful education programs that have been tried and evaluated. So in each of the areas that your subspecialists are working, there's almost surely excellent work that's going on out in the field. A good place to start for some of these materials is Medline Plus, which is the place where the government puts everything it's ever paid for in the way of patient education. Preparing people for what might happen is important. For people who have a problem that's ongoing, giving them self-management guides can be extraordinarily helpful. Again, the work that's been done in heart failure, asthma, and COPD has shown that you can reduce harm to patients and also the cost of expensive hospital care when they have at home a way to assess their function and indications about what to do next. And again, this idea about recovery after surgery has been picked up by the specialty groups so that they've even developed some special programs of education, which I'll point to in a few minutes. The other great thing that you can do for your subspecialist clients is to connect them to these chronic disease support groups. I ran a diabetes support group for 15 years, and they weren't my patients, but they had lots of questions and they had lots of things I could help them in understanding when to use their doctors, how to understand what their doctors are talking about. We did this with lay advocates and community nurses, and it turned out to be extremely helpful. And I got many calls from doctors in the community saying how their patients had begun to take much better care of themselves as a result of being in a support group like that. So you should be looking in your, online for these and making lists of those for your subspecialists so that they can begin to get their patients involved with them. We